Welcome to the Deep Dive. Today, we're getting into something really important. How to bring regulatory information management systems, RIMS, let's call them, into the digital age across Africa.
Yeah, it's a huge undertaking.
I want to unpack the strategy behind it, understand how it's supposed to change the way medical products are regulated, and ultimately, get better medicines to people faster.
It really is a critical moment because, look, for years, relying on paper, basically, in so many African countries, well, it's just created delays.
Bottlenecks.
Huge bottlenecks. And it makes it much harder to fight things like fake medicines, which is a massive problem. Imagine trying to find urgent safety data buried in a filing cabinet somewhere.
Exactly. Not efficient. But okay, there's a plan, right? Driven by NRAs, the African Union Development Agency.
That's right, their AMRH program.
With help from USAID and PQM plus BARDSPOT. They've actually built a strategy to digitize these RIMS.
And it's not just about getting rid of paper, although that's part of it. It's a much deeper modernization.
Connecting the dots, basically. Yeah. Linking up the national regulators, the regional bodies.
And the new African Medicines Agency, the AMA. Making them all talk to each other.
Okay. And that's what we're digging into for you today. We'll break down the strategy to look at the how and the why.
Yeah, hopefully giving you a clear picture of how this digital shift is meant to boost efficiency, transparency, and crucially, collaboration in regulating medicines across the continent, moving from scattered islands to a connected network.
Okay, let's start there. The current situation. What are the biggest headaches with these old paper-based systems? What does it actually mean day to day?
Oh, the problems are pretty widespread. First off, just pure inefficiency.
Things take longer.
Much longer.
Yeah.
And you often get inconsistencies between how different regulators work. So approvals for medicines can lag way behind other parts of the world.
Right.
And then there's the risk of just losing information. Paper gets lost, damaged, communication between agencies, slow, clunky, think phone calls, posting documents.
Yeah, you can see how that would really hinder any kind of joint effort, right? If agencies need to work together on something.
Absolutely. I mean, there are efforts to harmonize things like getting regional economic communities, the RECs, to use the common technical document for submissions.
Standardizing the paperwork.
Exactly. But even then, if you can't share the information quickly and easily, it really hampers joint reviews or reliance procedures.
Reliance being when one regulator trusts another's decision.
Precisely. Building on work already done. Paper just makes that incredibly difficult.
So this push for change, it has some history. What role did the AMRH play in getting this started?
Well, the AMRH program kicked off way back in 2009. Its whole purpose was to tackle these weak regulatory systems, the slow registration, the lack of technical skills in many national authorities.
The goal being better access to essential medicines.
That was, and still is, the driving force. Improve the systems to improve access for patients.
And then, more recently, the African Medicines Agency, AMA, came into being. How does that fit in?
The AMA is a massive step, established officially in 2019. It aims to break down those technical barriers to trading medical products across Africa.
Building on the AMRH's work.
Exactly. It sort of elevates the harmonization efforts to a continental level, and there's real momentum. By late 2023, I think 10 nations had ratified, 26 had signed, shows a growing commitment.
Okay, a continent-wide push. Now, RIMS, Regulatory Information Management System. It sounds quite broad. What exactly does it cover?
Think of it as the control center for a medical product's whole regulatory life.
From start to finish.
Pretty much. So getting the initial approval, marketing, authorization, registration.
Okay.
Then monitoring its safety once it's out there. That's pharmacovigilance.
Right.
Plus market surveillance, checking product quality, inspecting factories, licensing companies, lab testing, even overseeing clinical trials before approval. It's comprehensive.
Wow, okay. The entire lifespan. And these ring systems, they're not all the same. Some are more digital than others.
That's right. It's a spectrum. You've got purely manual, paper-based systems, literally rooms of files.
I can picture it.
The hybrid systems may be using spreadsheets for some things, some digital decision-making, but still lots of paper. And the goal, the endpoint, is fully digitalized RIMS. Using tech for automation, joining up all the data across those different functions we mentioned.
And the benefits of going fully digital must be huge, right? Why make this massive shift?
Oh, the advantages are significant. Better compliance, for starters. Digital systems give you clear, auditable records.
Easier to track things.
Much easier. Data management becomes way more efficient central, easier to update, easier to share. Collaboration improves not just within an agency, but with drug companies submitting applications too.
Streamlines the whole process.
Definitely. Submissions get faster, fewer errors, and you can be more proactive about risk spotting safety issues faster because the data is accessible.
Makes sense.
And then there's time and cost savings, clear audit trails for accountability, easier scaling as workloads grow, better data security. It really touches everything. It can even make a regulator more competitive, in a sense.
Okay, so let's dive into the strategy itself. What's the big picture aim here?
The main goal is really clear. It's about aligning this RIMS digitalization with the AU's big development plan, Agenda 2063.
Okay.
Specifically, the current 10-year implementation plan running 2024 to 2033. So it fits into that wider vision for the continent.
And what's really pushing the need for this specific strategy now? Just the problems with paper we talked about.
It's more than just knowing paper is bad. The strategy tackles the persistent hurdles head-on, lack of resources.
Money, skills.
Yeah, technical know-how, funding, sometimes even the political will hasn't always been there. These things have held back good RIMS adoption, so the aim is to move decisively away from systems that are underused, disconnected.
And crucially, don't talk to each other.
Exactly, non-interoperable. That's a key target.
So it's not just about each country doing its own thing digitally. There's a continental layer.
Absolutely. A really key piece is the IUA NEPAD IM's technical committee, developing a continental data repository.
A central data hub.
Sort of, yeah. And that feeds into an interoperable platform called the Regulatory Information Sharing Portal, or RSP.
It's RSP.
That portal is vital for enabling that cross-country collaboration and information exchange we talked about. Imagine regulators easily accessing relevant data from other countries. Securely, of course.
And the strategy document itself is the how-to guide.
It's the blueprint, yeah. It gives practical guidance to the national regulators, the RECs, the AMA on how to actually do this, adopt and implement digital RIMS.
Including how to connect to that RSP portal.
Yes, ensuring their systems are interoperable with RSP is key. And it sets out milestones for achieving that wider automation and linkage across Africa.
Makes sense. And it has to fit with what countries are already doing digitally, right? It can't just be tacked on.
That's a really important point. The strategy stresses aligning RIMS digitalization with national digital strategies, existing ICT policies.
So things like data governance, data protection
are baked in from the start, not an afterthought.
How did they actually develop this strategy? It sounds like a lot of input was needed.
It was pretty thorough. Lots of document reviews, naturally, but also, crucially, interviews with key people, stakeholders from all across the regulatory field.
Getting different perspectives.
Exactly. And they used a framework, the maturity model for digital strategy assessment, to guide the whole thing. It helps organizations see where they are digitally and figure out the steps needed to improve.
Okay, so it's data-informed, collaborative, and structured. Now, are there examples they're learning from? Things already happening on the ground?
Yes, definitely. There are important foundations. One is the AU model RIMS.
Developed by that IMS technical committee.
That's the one. It's significant because it lines up with the WHO's global benchmarking tool, the GBT. That's the global standard for regulatory maturity.
So it meets international standards.
Right. And it covers the 8 core regulatory functions WHO identifies. Plus, importantly, it includes those minimum common standards, MCS, for interoperability.
Making sure systems can connect.
Exactly. And it's not just theory. 7 countries are already implementing it. Botswana, Ghana, Rwanda, Senegal, Tanzania, Uganda, Zambia.
Wow. Okay. So real-world testing is happening. Any other key initiatives feeding into this?
For sure. You've got things like MTaPS, OpenRIMS RP, and OpenRIMS PV.
Catchy names.
Yeah, but they're open source tools designed to automate regulatory processes, registration, inspections, clinical trials, pharmacovigilance.
The safety monitoring.
Right. They build on experience from an earlier system called Pharmadex and are used in quite a few countries, even beyond Africa.
What's good about them?
Well, being open source is a plus. They're customizable. They can connect to other systems using API's digital handshakes, basically.
Okay.
They focus on sustainability, meet WHO standards, and support those minimum common standards again.
Good to see open source playing a role. Any other specific examples?
Yeah, the PQM Plus program helped with the Pakistan Integrated Regulatory Information Management System, PIRIMS.
PIRIMS in Pakistan.
Right. Implemented by their regulator, DRAP, with USAID support. It's a web-based system covering licensing, registration, lab tests, inspections, pharmacovigilance. A good example of an integrated digital approach.
So lots of practical experience to build on. The strategy also mentions regulators doing a SWOT analysis. Strengths, weaknesses.
Yeah, opportunities, threats. Encouraging regulators to do that for their own RIMS digitalization context is really smart.
Tailoring the big strategy.
Exactly. So opportunities might be, lots of regulators don't have functional RIMS yet, or there's a young tech-savvy population. Weaknesses could be lack of standardized documents, not enough resources, poor IT infrastructure.
So they need to understand their own starting point.
Absolutely vital for good planning.
And learning from past attempts is always key. What were the big lessons from earlier digitalization projects in this space?
Several stand out. Managing stakeholders effectively is huge. Getting buy-in, being clear about roles, what resources are needed from everyone.
People management.
Totally. Using agile project management helps too, being flexible, getting feedback, clear communication plans.
Adapting as you go.
Right. And really understanding the user stories. What do the actual users need the system to do? How does it fit their workflow?
Designing for the real world.
Precisely. Also thinking about how the new system fits with existing tools, and of course, solid training and ongoing support are non-negotiable.
So it's way more than just the tech. It's people, process, integration. Now, drilling down into the strategy document itself, what's the ultimate vision, the core mission?
The vision is about creating a model, a kind of repeatable approach for implementing digital RIMS across Africa.
A proven path.
Yeah. And the mission supporting that is to empower everyone involved, NRAs, RECs, the AMA, with really effective RIMS to boost transparency, efficiency, and compliance for all healthcare products.
And there are guiding principles to make sure this happens effectively.
Yes. 9 key principles for digital development. Things like design with the user, understand the existing ecosystem, design for scale, build for sustainability.
So it's that so.
Be data-driven, use open standards, reuse and improve existing stuff, address privacy and security upfront, and be collaborative.
A solid foundation.
It provides a really strong ethical and practical frame for the whole thing.
Okay, and beyond principles, there are specific goals regulators are aiming for.
Yeah, the goals focus on the quality of regulation, the efficiency of processes, the security of data and systems, and ensuring compliance.
All leading towards
better collaboration and smooth information sharing, national, regional, continental.
And to hit those goals, what are the strategic priorities? Where's the focus?
6 main priorities are laid out. First, strong governance and strategy for digitalization itself.
Getting the framework right.
Second, actually digitizing the core business processes. Third, implementing the right digital solutions, scalable, interoperable.
Makes sense.
Fourth, setting up those common interoperability standards with security built in. Fifth, making sure the infrastructure and connectivity are there.
The pipes and wires.
Exactly. And sixth, developing the necessary skills in the workforce for the long haul.
It's comprehensive. But before you even start digitizing, regulators need to get ready, right? It's not plug and play.
Critical point. The strategy talks about a lean transformation before digitalization.
Lean transformation.
Basically, reviewing and streamlining everything first. Legal frameworks, business processes, organizational structure. Get rid of inefficiencies before you automate them.
Right. Don't digitize a bad process.
Exactly. Plus, investing in staff training, setting up quality management systems, QMS, and using that WHO GBT tool to see where they stand, where they need to improve before the big digital leap.
Okay, optimize first, then digitize. Now, who's in charge of making all this happen? What's the governance structure?
It's well defined. At the AMRH level, you'd have a sponsor or steering committee for big decisions.
High-level oversight.
Then, the IMS Technical Committee for technical guidance. A Digitalization Technical Working Group to monitor progress and evaluate.
Okay.
A dedicated digitalization project manager for day-to-day running, and the project team doing the actual implementation work.
And who coordinates all these moving parts?
That's the RIMS Digitalization Secretariat. They're central, leading and managing the project daily.
Like the project hub.
Exactly. Organizing meetings, managing timelines, planning, coordinating, overseeing activities, resources, communication, reporting, documentation. It's a vital role.
Keeping everything aligned. And tracking progress is built in throughout.
Absolutely. Monitoring and evaluation are key. That Digitalization Technical Working Group is specifically responsible for tracking progress against the plan and budget, constantly.
Okay, structured, accountable. Now, the practicalities, resources. How does the strategy suggest funding this?
It addresses both money and people. Financially, it suggests NRAs should actively seek funding from donors and partners.
External support.
Yes, but also build sustainable mechanisms long-term, maybe through regulatory fees, national budget allocations, a mix.
And people.
Crucial need for dedicated IT teams, database admins, developers, network people, support, and also regulatory systems specialists, people who know the regulatory functions and the system.
Bridging the gap. And what about language? Africa's incredibly diverse linguistically.
That's explicitly addressed. The strategy recognizes this and recommends RIMS be customizable for different languages.
To ensure everyone can actually use it.
Exactly, for inclusivity and effectiveness.
What about the tech basics? Hardware, software, hosting.
Need robust infrastructure, obviously.
Cool.
Hardware, server, software. The strategy discusses hosting options, cloud, on-premise, hybrid.
Depends on the situation.
Right. And critically, you have to consider local laws about data sovereignty where data can actually be stored.
Big consideration.
Yep.
And cost. Any ballpark figure.
Based on experiences so far, the strategy gives an indicative average cost around $560,000 for full implementation.
Okay, and that covers
software, customization, migrating old data, integrating with other systems, training, hosting, all the key bits.
Gives a sense of the scale.
Yeah.
Now, a huge piece for making this work continent-wide is standards, right? Making sure systems can connect.
Absolutely critical. The minimum common standards, MCS adoption, is seen as fundamental.
What do they cover?
Ensuring data is captured consistently, standardized data formats, harmonized design and workflows. It's what enables that info exchange between NRAs, RECs, AMA.
The foundation for interoperability.
Precisely. Process standards, data dictionaries, data exchange standards, they're all part of MCS.
And it's not just technical standards, but also quality processes, QMS.
That's right. A good quality management system is seen as a powerful tool for streamlining things, improving efficiency. It's often needed for ISO 9001 certification.
The international quality standard.
And for reaching higher maturity levels on that WHO GPT scale. It's about continuous improvement, having clear standard operating procedures, SOPs.
Okay. Now, bringing in a huge new system like this, that's major change for people, how does the strategy address change management?
It's flagged as fundamental. You need a systematic approach to prepare people, support them, get them to actually adopt the new system.
Minimize resistance.
Exactly. Because without good change management, you hit resistance, you can lose money, damage morale, productivity drops. It's essential.
And part of that is training, surely, making sure people know how to use it.
Absolutely. Strong recommendation for comprehensive training, for the technical teams maintaining it, and for the everyday end users.
During development and rollout.
Yes, so by the time it goes live, people are comfortable and can actually use it effectively to get those efficiency gains.
Makes sense. And finally, making this last. Sustainability. How's that tackled?
From 3 angles: financial, technical, and human resources.
Okay.
Financial is about budget planning, diverse funding, cost control, thinking about the total cost over the system's life.
Long-term view.
Technical is ensuring the system stays robust, scalable, interoperable, secure, compliant over time. Hosting, databases, IT infrastructure.
Keeping the tech current.
And human resources is about having skilled staff, ongoing training, knowledge transfer to build local capacity, cross-functional teams.
Investing in people.
Yeah.
And sustainability includes keeping the system up to date. Maintenance.
Definitely. Maintenance is ongoing. Updating, improving, keeping it secure, compliant with new rules or tech, needs a proper plan and contract.
And all along the way, checking how it's going, learning lessons.
Yes. Monitoring, evaluation, and learning MEL. Constantly tracking progress, monitoring, periodically assessing design, implementation, impact evaluation, and systematically capturing lessons learned, learning to feed back into the process.
Continuous improvement loop. And this all fits into a timeline. A roadmap.
Indeed. The strategy lays out a phased implementation roadmap, typically around 4 years.
4 years.
Yeah, breaking it down: initiation, planning, development, deployment, integration, evaluation, ongoing maintenance, clear goals and milestones for each phase. A pathway to follow.
Okay, so pulling it all together, this digitalization strategy for RIMS in Africa, it's a really major forward-thinking move, aiming to genuinely modernize how medicines are regulated.
It really is. The potential benefits are huge: efficiency, transparency, and ultimately better access to quality medicines for people across Africa.
But it's a journey, right? Needs real commitment.
Absolutely. Strong commitment and collaboration needed from everyone, NRAs, RECs, the AMA, partners. Success hinges on focusing on those priorities, sticking to the principles, and learning from what's been done before.
And for you listening in, it's worth thinking about the ripple effects. What could a truly connected digital regulatory system mean for health and well-being across communities in Africa?
It's a profound question.
Definitely sparks further thought about where healthcare regulation and technology are heading. It's a space to watch. Thanks for joining us for this deep dive.